There's so many different routes you can take, and there's so many different options that you can do to try and manage pain.
One of the things we're all taught in medical school is if you listen to the patient will tell you the diagnosis. Now that I've been doing this for about 20 years, I can assure you that is completely true. I walk into a room and I see the person. Are they sitting? Are they standing? Are they leaning? That body language tells me immensely what area of the body are they protecting, what area of the body are they depending on.
Some people seem to take a lot of medicine, some people like to try different routes, but you just need to find the one that's right for you.
The epidural refers to a potential space in the body. That's where we're going to put medication. The epidural can be used in labor so that you don't feel the pains of labor. In pain management, we use it to provide a steroid medication close to the region of pain.
I had no idea what it was. It was a leg pain. And I went to the doctor who had treated me for neck problems, and he said, "Oh, it's your back, and we can give you a shot." And I said, "Well, can you give me a shot right now?" He said, "Oh, no, it's not that kind of shot. It's an epidural. You've got to come back. It's a big deal."
Steroids serve three functions. They cause pretty close to immediate pain relief, but mild. They bring down inflammation, and they also change how your body feels. Who's ever doing this procedure for you will find this area of your body under some type of guidance, usually X-ray. Fluoroscopy is real-time X-ray. Now, for this procedure, you'll have to stay very still. Often on your stomach. That can be a challenge then in of itself. You will be awake. It's a twilight sort of sleep, similar to what happens when you have a colonoscopy or other types of outpatient procedures. That means you don't eat for the day, you take only the medications as instructed to take, you have somebody drive you home.
They put you out with the twilight sleep, and you wake up and you go home. You're not allowed to drive for a day. Your back is sore. Sometimes the epidurals would work.
It's important to remember something is now in your body where nothing has been. There can be a lot of stretch. You may feel weak. You may feel nauseated. These are different types of nerves than have ever been stimulated in your body before. It's also important to allow your body a chance to rest. So respect that. Give your body a chance to heal.
I actually know people who've had selective nerve blocks. They put some steroids in there and they put some local anesthetic in. And 2-3 years later, they're still walking around and they did not need to have the surgery.
Now, for some people, even after they've received a steroid injection, the pain relief doesn't last very long. So for 4 weeks, 6 weeks, maybe even 2 months, they feel great. And then that pain starts to come back.
I would get 3 weeks of relief and then the symptoms would come back. I went for a total of 3 nerve blocks, and that didn't work.
Because your pain does become part of you. And I need you to own your pain, just like I need you to own your body.
For a period of time, every once in a while, it would kind of creep back into my life. At one time in particular, probably about 10 years later, where it was really bad, we were able to address the pain medically, mostly with steroid treatments. And we're able to kind of get it back under control. I was able to sort of live my life and do things like play tennis and play with my kids, and it was all good.